Hi, my name is Beth Rowe. I will be discussing my study today. The title of the study is The Effects of Correction Insulin, Basal Insulin, on Inpatient Glycemic Control. First, we're going to look at the purpose of the study. Glycemic control can be very difficult in hospitalized patients, especially considering the fact that the added difficulty of patient acute illnesses and surgeries. The reason for this study is to look at hospitalized patients with type 2 diabetes to determine whether we can benefit with a tighter glycemic control to prevent hyperglycemia and other complications. Hyperglycemia in hospitalized patients have an increase in nosocomial infections, sepsis, longer stay in the hospital, and prolonged wound healing. Okay. The next thing I'm going to discuss is glycemic control is very challenging in hospitalized patients with type 2 diabetes. A major barrier in a tight glycemic control is the potential for hypoglycemia. Patients at risk for hypoglycemia are renal failure, pregnancy, malnutrition, shock. Few studies have been done to address tighter glycemic control in hospitalized patients with type 2 diabetes. Little is known about the effectiveness of Basal Plus approach, basal correction, and prandial therapies. This study examines hospitalized patients with type 2 diabetes. It looks at two different groups with type 2 diabetes receiving two different regimens of insulin. The first group looks at the correction of insulin on the patients by a sliding scale insulin, and the other group looks at basal plus insulin correction. Okay, we're going to look at the problem, which I already discussed that. The problem is that there's few studies that looks at type 2 diabetes hospitalized patients with tight glycemic control. It also, there's little evidence that is known about the basal approach, basal correction, and prandial therapies. The significance of the nursing practice is that the study is significant to the nursing practice because the sliding scale is a contemporary standard and used in nursing practice. In 2007, Perez in 2007 concluded that the sliding scale is a monotherapy and it is not associated with the improvement of clinical outcomes. So the sliding scale is not tailored to patient-specific body size, nutritional value. Next thing we're going to look at is the sample setting. The size of the selected group was 90 randomly selected patients. It was computer generated, and the inclusion criteria that they went over was they had to have a history of diabetes type 2, admission prior to a year, and length of stay is 4 plus greater length of stay. Exclusion was pancreatitis. They also looked at if they were admitted to ICU, they were excluded. Diuretics, if they received diuretics, if they had a feeding tube. Those are just a couple examples that were included in that. We are going to look at the study design. The study design was a descriptive retrospective design. Look at it like looking in the rearview mirror. They were looking at past patient records, and they pulled these records, and there was no, when you look at it, with no intervention. Next thing is the data collection. What is entailed in the data collection: the age, the height, the weight, the sex. It also looked at the length of stay for the patient. Also the glycemic blood glucose was collected in 3 consecutive days using the retrospective charting. Ethical issues, there was really no safety issue because it was a retrospective study design. There wasn't any patient safety issues. HIPAA and IRB was reviewed and approved, and they were able to pull the records back. And variables in the study, we have a complete blood glucose count of of 60. Complete greater than 180. Fasting blood glucose was 130. The next slide is the findings. What it concluded is it revealed that the blood glucose control in the selected group was very poor. They discovered that they need insulin therapy to be more intensive, to have a tighter blood glucose control. 49% received the Basal Plus, 51% received the correction insulin therapy, 22% received the prandial therapies, 70% of the Basal Plus therapies were hyperglycemic, 40% of the correction therapy were hyperglycemic. Now we're going to move on to the usefulness of this study. Well, we need to educate our nursing staff about the hypoglycemia, signs of hypoglycemia and hyperglycemia. We also need to be patient advocates and give our attending physicians a heads up when we see signs of hyperglycemia. Next thing we're going to look at is the conclusion. There was a limited study. Even though they were able to draw up 90% of the records, there were only 45 met the criteria. There needs to be future research in this topic. Education also needs to be done on the nursing staff, and we need to improve glycemic control overall. Here are my resources. That concludes my topic for today. I hope you enjoyed my study. Thank you.